Hi, this is Dr. Matt Joosse, owner and orthodontist of Joosse Family Orthodontics in Williamsburg, Virginia. I often get asked the question, at what age should my child be seen for their first orthodontic evaluation? And I like to see kids by age 8. Now I'm about to show you a case that illustrates why I like to see kids by age 8. And before I actually show you that case, let me just tell you that most of the time when I see an 8-year-old or a 9-year-old or a 10-year-old in my office, I am probably not going to recommend treatment. Most of the time treatment is not required. However, there are occasions which I'll recommend early orthodontic treatment, or what we call phase 1 treatment. And there's usually 3 reasons why I might indicate phase 1 treatment. Number 1 is there might be a problem that's interfering with the growth of the jaws, and you really want to intervene in those early when lots of growth remains. The second reason why you might want to do phase 1 treatment is because sometimes you need to intervene with problems that are going to prevent the eruption of permanent teeth. And then the third reason why you may want to do early orthodontic treatment is because sometimes there are problems that, if left untreated, will cause major complications later. It might make the orthodontic treatment later much more difficult, and the case I'm about to show you falls into that category number 3. It's something that we're treating this case because if we left it untreated, it's going to be very, very difficult to treat later on. So let me show you that case. Okay, so here's the case that I was just alluding to. And this patient came into my office, and the reason why they were coming in for their orthodontic evaluation was because of this. These are the lower front teeth, and there's a lot of crowding of those lower front teeth. The mom was concerned about the crowding. Actually, the dentist had not referred this patient, but it was just the mom was concerned about the crowding and was wondering if there was anything that we should do about the crowding right now. And the boy was 9 years old. So when I saw him for my evaluation, I was concerned about this crowding, but I was more concerned about what you're going to see here. I was more concerned about the position of this tooth and this tooth. These are the lower permanent canine teeth. And what I didn't like about these two teeth, I didn't like the angle that they were at, and I didn't like how this one on the right side was completely overlapping the lower incisor on the right side, and the one on the left side was completely overlapping the root of the lower incisor on the left side. Now, I'm going to switch to a different case to show you what can happen when these things don't get noticed by the general dentist, or when the patient doesn't come in for an evaluation by an orthodontist. So this is a different patient, and I unfortunately did not see this patient until he was 15 years old. And these are the permanent canine teeth. They were probably once angled just like that first patient, but nothing happened, and so they just kept coming in towards the middle, and here they are, and they're just causing a mess. These are the lower incisor roots being all sorts of displaced. There's probably been some damage to those lower incisor roots, and this is an incredibly difficult case to treat now. Again, this patient here is 15 years old. He's now in orthodontic treatment, and we are trying absolute heroics to try to avoid taking out permanent teeth for this particular young man. So this is what we're trying to avoid. Now I'm going to go back to our x-ray here. This is our patient when he was first seen, and I recommended that we do some early treatment, although I actually did not recommend that we do anything orthodontically. So there was no movement of teeth involved. What I recommended was that they take out a few baby teeth. So I recommended they take out this baby tooth, the one that's a filling right there, the one right next door, and the same 2 baby teeth on the left side. And my thought process here was that if we just take out some of the baby teeth, some of the adult teeth will come up, and then these canine teeth will follow their friends up and into the mouth. So this family accepted my treatment plan. They went and had these 4 baby teeth taken out, and I understand that having 4 baby teeth taken out isn't high on anybody's list of things to have done, but that's overall a pretty conservative treatment. Again, no braces, nothing to actually move teeth. And so we just took an x-ray on this young man, and here he is 9 months later. So 9 months later, those 2 teeth were taken out, those 2 teeth were taken out. We did put in a retainer just to make sure that we hold open all that space. And here we go, these teeth are coming into the mouth. These canine teeth have really uprighted. There's still just a little bit of overlap of the roots of some of the lower incisors, but these teeth are going to come into the mouth just the way that they should. So they might have lost their way at one point, but because we took out the baby teeth and held open the space, these permanent canine teeth are going to find their way into the mouth. So this is a great example of just a really conservative phase 1 treatment, some really conservative early orthodontic treatment This is a great example of good intervention that really created quite a disaster that could have occurred later. And it's a great example of why we like to see kids when they're young. So again, this boy came in when he was 9 years old. I would have loved to have seen him at 8. We could have noticed this at 8 years old and done the exact same thing. So that's why we like to see kids at 8 years old. That's why early treatment works so great. And if you ever have any questions, please contact me at www.joossefamilyorthodontics.com. Thanks so much.